Thank you for being here this morning. Today I'm introducing the Protecting Women's Access to Healthcare Act. I just dropped it, so it's H.R. 5650. Joining me today is Darlie Crockett from Planned Parenthood and Candy Strait and Susan Bevan with Republican Majority for Choice. As a pro-choice Republican, I believe that this legislation is critical because it ensures non-discrimination within federal Title X family planning program. Specifically, this legislation says that when it comes to participation in the Title X program, healthcare providers such as hospitals, healthcare clinics, including Planned Parenthood, cannot be discriminated against and excluded simply because they choose to offer additional services separate from Title X. This legislation is needed and is certainly timely. We have seen in Congress and in several states across the country an attempt to block funds Title X participants simply because these providers separately provide services beyond the scope of Title X funding. Just this past week, another state cut off funding for Planned Parenthood. With a struggling economy, we certainly should not discriminate against hospitals and organizations that provide access to basic, preventative, and in some cases life-saving services for so many underprivileged women with Title X funding. I think it's important to continue to raise awareness about the good things the Title X program is doing. And this is something that I've done since my arrival in Congress. I spoke out on the House floor last year about Title X. And more recently, I delivered testimony to the House Budget Committee to again emphasize its importance. Title X funding is nothing new. For over 40 years, Title X has provided access to contraception and health education to women. This funding also provides preventative health care, HIV testing, annual exams, cancer screenings, and so much more. Millions of women around the country rely on access to Title X programs, and Title X providers serve as the usual or only continuing source of health care for more than half of these patients. Nearly 70% of the individuals who utilize Title X funding are at or below the poverty level. That is why we must work to affirmatively protect access for millions of women who receive health care through Title X participants. Just last week, I had the opportunity to tour a Planned Parenthood facility in Chicago and see how Title X programs help women. I was able to see healthcare providers interact with underprivileged women and ensure that these women receive preventative health care. Planned Parenthood provides a variety of wellness services and preventative care. Women who otherwise would not be able to visit a doctor today have access to basic care that they need to prevent long-term illnesses. I look forward to working with both sides of the aisle to build up support for this level-headed, reasonable legislation. And I look forward to raising awareness for how the Title X program works. Access to care shouldn't be jeopardized simply due to discrimination against hospitals and healthcare entities based upon separate services that they choose to offer. This is an area where I believe that we should find common ground. And I do look forward to working with my colleagues to do so.